So he has put on a pair of goggles.
You know what we're talking about today?
I have no idea.
Let me introduce it.
Hello.
Hello. Hello. Hello. And we're at a radio station. So what does that all mean? Those are different frequencies.
Were you going to guess that, Mike?
I was thinking that.
Yes,
Okay.
it's because I spilled the beans to him earlier.
Oh, okay.
So the use of frequencies, we're at the radio. What 99.1, okay? And AM, FM, different frequencies. You're in your car right now or at home. You have a frequency receptor called your radio, and we're just passing frequencies around. And so the body is full of frequencies. You go to the doctor, you have a heart attack, and you're dying. What do? They put a frequency emitter on you, those paddles. Boom, boom. You go to the doctor, the cardiologist, they're looking at your frequencies of your heart, the beat, the rhythm, your neurologist, what's your EEG.
I was at my cardiologist the other day.
Did they find a heart in there?
They were checking my aneurysm.
Yes.
I've had one for years and years.
Be careful, my friend.
Well, it
Be
hasn't
careful.
changed size.
Yeah.
And it hasn't moved. There's no change. They're checking it every 6 months now.
So these frequencies, what I'm involved with...
Doesn't matter about my aneurysm.
Aneurysm? Well, I'm worried about that
By
problem.
the way...
I'm worried about that problem you have in your brain.
just real quick, I had an interview yesterday with a gentleman who is, in fact, I'm going to give you a copy of the book before you go.
Okay.
Who talked about pretty much along the ways of you do. This guy's talking about how checking, knowing who you're talking to, what it costs, what they do, and everything else. And what reminded me of that was one of your patients. You recommended they have some blood work, and then they got a call from somebody saying they were going to read their blood work. Did they want to come in and talk to him? And it was going to cost $200. And they said, no, send it to my PCP.
But I know who you're talking about, and I know what's going on.
Yeah.
That person who I sent that person to, I sent him to a different person, the reader, the test giver, the Williamsburg drug who does all this testing,
Yes.
They have a zillion physicians and specialists as their patients. They specialize in reading these things, and I can guarantee you on a stack of Bibles that the gift of that interpretation of the pages and pages of information will not be better delivered than by the person who was asking compensation for their time.
Okay.
It is an encyclopedia of information.
It was out
and
of
unless
the,
you're
I
in
think
that
it was out of the blue. That was the surprise.
All right. Okay. So duly noted, and I'll talk to that person about that person, and so I know who we're talking about. But that's where you where do you spend your time, and what do you become good at and interested in. And so this is the interesting thing is this device you see. I'm holding up a little looks like the size of a big cell phone.
A thick calculator.
A thick calculator with a bunch of buttons on it with numbers and it basically it's a selector of different frequencies that are emitted from this, and from this little big fat calculator are wires going to what look like a pair of goggles, or motorcycle goggles that have a gasket on them, and hidden behind this gasket are electrodes, and these electrodes are going all around my eye. We have these acupuncture points around our body, all over our body. And so there's these different spots where these electrodes are going to be emitting frequencies that are selected for your needs. And then on the back of this headset are some little pokey things. You see those right there? Mm-hmm. And they're going to they're just little receivers.
Okay.
And so what happens is ultrasound jelly goes around the front of your eyes on this rim and on the back. And these frequencies are passed through your eyes. And never a problem, low energy. And there's two frequencies. There's dual frequencies. And the quick way of talking about it is one's for the issue and one's for the tissue. And so the issue might be inflammation. The issue might be pain. The tissue might be muscle. And then you can get down to, well, is it muscle or is it fascia? Is it cartilage? And everything has a different frequency. We know that this plexiglass here in front of me versus this wood versus this Lexan, all is moving. Just these atoms are moving a little bit. And like the Tacoma Narrows Bridge, remember galloping Gertie or whatever it was? And when the wind went over that bridge in Tacoma in Washington, it had the same frequency and it destroyed the bridge. The soldiers who have to march out of step, because when they march in step, they can ruin things at the same frequency. And so remember the Memorex commercial back in the day when, who was it? Is it Livers and Memorex? And they would shatter the glass because that person gets in the same pitch, intensity, resonance, frequency, all these different descriptive terms that is going to be either destructive or constructive.
Let me interject with something here. I want to make sure somebody who's just tuning in knows what's going on. This is Dr. Wilcox. He's an eye doctor down at the Point. I've said it before. If you're just interested in glasses, contacts, he does that. But when you go to see Dr. Wilcox, he gives probably one of the most researched people I've ever met.
Thank you.
I have to admit. And he is in touch with experts in different areas all over the world constantly reading and updating. And he may, in a given situation, offer you options. And when he comes in here, what we talk about are some of these options that are available. So I only interject that because I don't want to scare anybody off.
Sure. Yes, and thank you.
He's not telling you need to put these goggles on so I can emit rays into your frequencies, into your eyes, to the back of your head. He's telling you, look, I have this option available that may help you in the long run, in the short run, immediately, in 3 weeks, in 1 treatment, in 10 treatments. Would you like to learn more?
Yes, and thank you for the distillation of me and what we do in our practice. Next week we have our this study starting. There's 4 of these gizmos
in the world.
One's in a VA hospital in Florida. One's in my office, one's in California, one's in Washington State. So this is 2.0 of a study that was done by a brilliant doctor, Lori Chaikin. Hello, Lori. And so she used frequency specific microcurrent, these dual frequencies, on a number of different patients with eye conditions. And they showed that they took these, quote, previously untreatable retinal diseases, which is somewhat true in that they're previously untreatable. And they all got better to some extent, some significantly and some not, but that's how the study goes. And now there's a better contraption here with this setting here. And we're going through at these 4 locations, about 40 patients. And next week I have I'll be contributing my part, and probably actually a bigger part, because I have I capture a lot of interest with these different patients, and I have a lot of the technologies that allow us to do the pre-testing, peri-testing, and post-testing to prove that things are getting better with all the OCT and these fancy visual field units and all these different toys that I have. So patients are coming in, they're being baselined, and they're going to come in 24 times over 3 months and sit their rump in a chair in my office for short of an hour to have these frequencies exposed to their eyes.
Now, I'm going to ask a question right now. And it's not a question that I normally ask. Since you're part of a study, do you get this treatment for free?
Good question.
Well, I was a little uncomfortable asking.
So this is, no, it's perfectly fine. And it's actually something I talk to, and it's an excluder for some people, because it's the Bank of Peter who's funding this stuff. And when I have 6 employees, and everyone who's going through this, they have to participate in some of the funding of it. We farm out what we can to insurance, but insurance doesn't recognize this specifically, but they will once we go through all the due diligence of proving these things. And this is the future of treatment of eyes. So it's done in the research lab setting, and this isn't the first person to do it. but we're doing it differently with a different delivery device. And the goal is, at the end of the day, to have something that humankind is going to use more routinely. So instead of getting a needle in your eye when you have macular degeneration, that's what goes on. You're going to get frequency. Well, that's what happens. And so the diabetic with a swollen retina, you can use these things. The person with these membranes in the back of the eye, it's inflammation. It's circulation, it's perfusion, it's oxygenation. And then the big picture at the end of the day is, you can't, we exclude people from the study who are allegiant to their 3 sodas a day and their bad diets, because you can't be a firefighter putting a hose on one side of the house with a fire and to put out the fire, and somebody's throwing gasoline on the back. And so people want to do those things, and it's silly, but it's true. And so we have people who have to be committed to lifestyle changes along with the introduction of these other things. For the people going through this, it's 3 months. It's a lot of time, and we're happy to take more people, because you have to have the condition. We can't take somebody who's perfect and study them, because we're not going to make you more perfect.
Sure.
You got to have boo-boos that are bad enough that, on a scale of 1 to 100, 0 to 100, 0, you don't have something, 100, it's the worst. We're looking for those people between 20 and 60% bad, because we want to move that needle backwards by virtue of our actions and efforts. And we do those things. It's tedious. It's hard work. It's truckloads of work on the front and back side, and organizing things in spreadsheets and arguments with other doctors around about how we do it. This IRB, you have to have an IRB, International Review Board, which is a governing power, which is good, that says they keep their eyes of you and make sure that you're keeping in the right protocols.
How did one of these end up in a veterans hospital?
Because
that just seems like out of 4 locations, seems like that's not a fit.
Well, what happens is, call me a weirdo, and because of these crazy things that I do. And so weirdos tend to find each other. And so you have to be an eye doctor who's a weirdo, who likes doing these things, who then has access to patients and the technology. It's like finding a 4-leaf clover and that's got polka dots on it, and they're hard enough to find 4-leaf clovers, and you're going to find somebody who's unique in these regards. So you have to be someone with the patience, the tools, the acumen, the interest, and the willingness to give of your time, talent, and treasures in order to have these results. And that's so we find each other. That's why we're around the country. So you go to a meeting, or you read a paper and you reach out. I'm a huge networker. If I see somebody's name in a paper and whatever, I'll call them up. And it's amazing how that works. It's just hello. Yeah. And if most
anybody
people,
that writes a paper, you included,
yep,
are not only totally flattered, but more than willing to talk about it if you call, if you reach out.
Yes, yes, and so on what I'm promoting is the fact that we're doing these things for people with sick eyes, and so at the end of the day, people are going to have to participate on these 24 hours of treatment, not to mention all the front and back side, and it's short of $1,000, sort of out of your pocket to do these things, and because I'm paying my staff, nobody's paying them, but I'm a money launderer at the office, and every person is, every employer is. Yes. Money comes in, money goes out, and so frequency specific microcurrent. People can look up FSM. They can look up the word Chaikin, Lori Chaikin, CHAIKIN, and you'll find it on Google. And you'll go, oh wow, look at this, and oh wow, look at that. And I'm in Gloucester, for God's sake. I'm in Gloucester, Virginia, and this is going on, and it's kind of interesting. And speaking about that, I was talking to a patient. Apparently over in York County, there's a golf academy, a research center. The #1 golf research center in maybe the world is in York County. Why would that be in York County? So
you'd think it'd be in Myrtle Beach.
You'd think, that field of dreams. If you build it, they will come. And so I like this stuff, and it's a lot of fun. I can never run a practice where I'm just making donuts all day long, doing the same old thing over and over again.
Right.
I quit.
Got to change the subject. I got a personal question.
Yes, sir.
I have been experiencing lately a lot of eye watering.
Okay. And you are because you wear a mask. The mask is making a horrendous impact on ocular disease, external ocular disease. We're seeing the numbers of lumps and bumps in the outside of the eyes and the teary eyes. So what people can do, you can use colloidal silver, properly dosed and manufactured, because it helps. These little nanoparticles of silver help out. You can use hypochlorous acid, not hyperchloric. We have this stuff at the office. And there's Avenova at the drugstore, and there's these little sprays that you can use that help kill the bugs. Because, our noses are pointed down for a reason, not just so we don't drown when we go out in the rain, but all of our exhaled gas, which is full of bacteria, full of carbon dioxide, moist, isn't going into our eyes. And what are we doing with these masks? We're blowing all that stuff in our eyes. So, one, wake up in the morning, spray your eye with a little bit of hypochlorous acid, just let it seep in. It kills the bugs, okay? And it's for lid disease and skin disease and whatnot. Our body makes hypochlorous acid. We make peroxide. We make all these different things in our cells. Use the properly, I like this Argentin 23 colloidal silver drops. You can put those in there. And hot
Where do you
compresses.
get those?
At the office, we have them. And you got to be careful on that internet. A lot of people do a lot of crazy things. Yeah. And so, but those are some of the over-the-counter things. Oh, there's nothing wrong with a warm washcloth and Johnson's baby shampoo. It's dirt cheap. It works. And in the shower in the morning, you just get a lather going and you wipe it on your eyes, and that'll debride you of some of the crud there. Midday, do something midday if you're susceptible to lid disease. But yeah, lots of it, well reported in literature that with these masks, all these eye problems are going on. Not retinal problems inside the eye, but superficial eye problems.
By the way, I stopped by, got a couple of boxes of your
lid wipe, lens wipes,
lens
glare.
wipes to keep them from fogging up with the mask on.
Works fantastic.
I have shared them with people that, and this really works. I'm like, yeah, and it really works. It really works. $8 a box for 20.
Yeah, and it lasts all day. You can pass it around the office. You can get a lot of lens surfaces with that one. Yeah, and that's great. And it's something that wasn't there before all this happened. And necessity is the mother of invention, right?
All right. Doc Wilcox is at Gloucester Point. And again, if you want glasses, if you want contacts, he's there for you. May offer you other options, may not. And if he does, you are not obligated. But he has them, he researches them, and he likes to make sure he takes care of you from your eyes up and your eyes down. How was that?
That's a great one.
That was pretty clever.
Thank you.
Yeah. It's what
Neil,
I'm paid for.